Hi, listeners. So, welcome back to the Thrive for Life podcast. I'm so excited to be back. It's been a long hiatus. So, thank you for your patience, and I'm happy to be chatting and sharing some awesome information with you all. So, in today's episode, I'm going to be interviewing Dr. Jenna Mullen of Nalu Physical Therapy. She is my pelvic floor physical therapist and has been in my first pregnancy and now into my second. As you know, that I'm pregnant. I'm about 24 weeks pregnant now with my second baby. And I'm so thankful for my body's ability to create life and at the same time be healthy and strong enough to continue to do the things that I love to do. I know that it's not the case for all mamas out there, and I wanted to kind of shed some light around what is healthy movement for us, what should we focus on, what to do when you are experiencing some symptoms within the back, the pelvis, in the perineal area that may seem like new to us all. What are some conditions that warrant us to stop exercise or maybe definitely modify it? We're going to go over all kinds of stuff, all these like really common questions that she comes across. And I hope it gives you some insight into continuing to stay moving and keep your body healthy, keep your mind sane throughout this chapter of your life. So stay tuned. Thank you for listening. Hey, Jenna.
Hi,
Welcome to the
Adrian.
podcast.
Thank you.
Yeah,
Happy to be here.
nice to have you back. Go ahead and just reintroduce yourself a little bit and what do you do and who do you help, Jenna?
Yeah, thank you. My name is Jenna Mullen. I'm a doctor of physical therapy and owner of Nalu Physical Therapy, and I specialize in pregnancy and postpartum care, pelvic floor care, all the things. I'm a physical therapist, but I dive deep into what's going on beneath the surface.
Beneath the surface. Yes. You get inside there.
Literally and figuratively.
Yes. Emotionally, all the things that we need. The focus of today's chat, I mean, it can go a lot of different ways. Let's focus on like the first question that I have for you is just besides the common symptoms of pregnancy like nausea, fatigue, breast tenderness, cravings, and like potential mood swings, what are some other symptoms that you see in your clients that your mamas are facing during pregnancy and postpartum?
Yeah, so starting with pregnancy, I think a lot of times women have, I mean, I would say probably bladder leakage, being the most common. And I think there's actually some people that know what I mean when I say bladder leakage, and then others are like, "Oh, I don't have leakage. I just sometimes pee a little when I sneeze." And it's like, well, that's bladder leakage, anything that's
Yeah.
like involuntary loss of urine or even loss of bowel can be an issue for some people as well. We call that incontinence, and there's something you can do about it, as I'm sure we'll dive into. But that might be the most common. And, pelvic aches and pains and back pain, are also a pretty common one that people actually do know that there's something they can do about it and reach out. Trying to think if there's any other big like issues. Those might be the largest ones, but then I have a lot of women that are wanting to be preventative and are seeking out help to, make sure they are in a good position to have birth, or yeah, to have a smooth birth and recover faster postpartum. A lot of them come to me thinking or asking about, I want to make sure my pelvic floor is strong for birth. And that leads me to, a lot of education that I get to do about that's great for postpartum. That's something that we check on, but we actually need these muscles to open, soften, and relax and lengthen for birth. And so strength, is not necessarily a factor. So from, my opinion and approach and but knowing that they are going to need that strength right after, we look at and tackle both of those things together.
Cool. So around like leakage, is there a general time frame that you have seen leakage um, go away, like anywhere from like the least amount of time and like how long has it taken somebody to get it to resolve?
Yeah. And do you mean during pregnancy, like during our treatment sessions or
Yeah,
postpartum?
those are two different questions. I guess let's see during pregnancy.
Yeah, so it depends on, why someone might be having leakage. And so that's the art of what I do, is I get to see the person that comes in before me, and I try to always go in open-minded and to see what they are presenting with, because their story and reason why they're having an issue could be completely different than the person I just saw before, even though they might have the same presentations. So the well, and you know this, Adrian, as a patient from your first birth, sometimes we can resolve leakage in one session if, it was the bladder being pushed off to the side or something, and I can tune into the bladder, help, move it just like I would as a PT moving, the shoulder and helping it get its full range of motion back. Sometimes it's a little restricted, just needs a little help and guidance kind of into being able to sit in its proper place. And then it's happy. It's not going to send those signals of, I need to go to the bathroom right now. And in one session, we can resolve like that potential leakage or that urgency, which is that I have to go right now, which
Yeah.
is just the bladder trying to communicate something, and it only knows one way of communicating. And so some women are like going to the bathroom all the time thinking it's because of baby, of course
Mhm.
they're pregnant, they've got pressure, baby's pushing on the bladder, so they should be going all the time. And that's usually not the case. The bladder is just in an odd position or being like compressed in some way or whatever the case might be. And in those situations, with a little bit of hands on work and, a session or two, it's like, I actually can hold my pee. I didn't know that was possible.
Yes,
So it's pretty
yes, yeah.
cool. Yeah.
That was really, really cool. When I experienced it, it's like it was just such a gentle maneuver, but it provided like immediate relief and that sense of urgency. I mean, like I could hold it, but I felt like I had to go way more frequently. And then after that one session, it was like, I don't really, yeah, the urgency really isn't there. It almost felt normal again. But speaking of normal, like what is, so it's common to have urgency, but is that normal during pregnancy?
Yeah, it's not. I think any time that we feel that like I have to go and I have to go right now, there's a reason for it. And sometimes it might just be that we had coffee and we know that coffee and alcohol, some acidic foods for people that have maybe a more sensitive bladder, spicier foods, things like that could irritate the lining of the bladder itself. And that might be why it's like, hey, I got to get this out right now. We
Yeah.
know that UTIs also give that urgency. And again, that's irritating the bladder, the lining. And so the lining of the bladder, excuse me. And so it's going to say, like, I need to go to the bathroom right now. Usually, if you go to the restroom, get that out, maybe, increase your water fluid intake can also help with the urgency. That could help. But then, yeah, I mean, there's other reasons why it could be telling you need to go right now. And that could be, like I was saying, the position of the bladder. As we know, during the later parts of birth, when baby really is sinking into the pelvis, but that's like, month 8, or
Hmm.
like
Yeah.
towards the last like, 8, 9 months, like where you're almost there. That's where the bladder really will have less room to expand, and you really will just feel like I'm full. My bladder is full a lot quicker. But usually, if it's like, I gotta go and I gotta go right now, it's the bladder irritated for some reason, internal or external reason. And a lot of
Yeah.
times there's something you can do about it.
Okay. Very cool. Yeah, that almost reminds me of like your stomach. You can't eat as much towards the ending part of your pregnancy because they're literally like you're out of room.
Yes, you're out of
Yeah.
room.
So
Yeah.
it's like, okay, the bladder only has so much like space to expand now. Okay.
Yep.
So common but not normal, likely towards the ending, like the very like ending part of the third trimester would be normal to have more urgency just because depending on how large mama is too, especially if she's like carrying multiples or something, that
Yeah.
can be more common.
Yeah.
Okay.
Yeah. And then if you've got like a bowel movement as well, that's like making its way down, that's also going to make less
Hmm.
space for the bladder because it's only, it's a small, I've got my pelvic model here right now. So, it's like it's a small area. And if the baby's lower in there, the bowel movement is filling the back part. It's like the bladder really does, have less room to expand. But it should more be that like I feel full and I need to go to the bathroom. But if it's like I'm leaking and oh my gosh, I have to pee this second. And if I don't get to the bathroom, I'm gonna like leak my pants or, anything like that. That's a sign that like your bladder is unhappy and, it's not necessarily like that normal, I don't have much space to fill anymore. If that can make, yeah, if that makes sense. But
Yeah.
yeah, and sometimes it is just baby comes out, the bladder can find a better position and that goes away. But then other times, women, on the flip side, afterwards, they used to be okay and be able to hold their urine for what's normal, about 2.5 to 4 hours is a normal time to be able to hold your urine. And so if you're going every 15, 30, even, an hour, that could be a sign that your bladder is not happy for some reason. And then some women, used to be able to hold it, maybe had a little bit where they had to go more often during the later stages of pregnancy, but then postpartum, oh man, they have to go all the time or they leak. That can be baby moving, the bladder to make its way out of the pelvis. Or if you had a C-section, maybe the uterus and the scar from that surgery is kind of adhered, and the bladder can't get in a good position. It can't fill properly because there's some restriction on it. That it can tell you, hey, I'm not okay through that. We got to go to the bathroom right now.
Yeah.
Like I said, that's the only way it knows how to communicate. And so it can tell you that, and you think, I have to go to the bathroom. Really, you technically shouldn't, right? It's only been 15 minutes since you went again. So
Yeah.
those are the signs that, like, hey, something's out of balance here. And the faster a woman can identify that, get into, seek help and get the right kind of help, and then they don't have the compensations and the
Yeah.
fear and the shame, that can like come around
Yeah.
if it's happening longer and you have like leakage accidents when you're out shopping. It's like then you get scared of that happening again. And there's that trigger of fear that then we kind of have to work through that. And like, all these other compensations that can happen the
Yeah.
longer that somebody has these issues.
Yeah. So would you say like being able to hold a full, well, not a full bladder, but hold your urine for 2 to 4 hours is a good goal to be able to hit postpartum? Is that like a little milestone, would you say? I
Yeah,
don't even
I
keep track
do.
of that, but yes, yeah, that's good to know what normal ranges should be. Because if someone is just like, oh, I go every hour, that may be a little bit too frequent, or you're having those bladder irritants like coffee a little bit too much. Is that
Yeah.
an indication? Okay.
It could be,
Yeah.
yeah. Yeah. So if somebody's having, bladder issues, they could just start with, you know, writing down like for 24 hours at least, what they're drinking, what they're eating, and seeing are there any patterns of like, oh, the days that I have coffee, I really like I have a lot more leakage those days, or just I feel like I have to go every 15 minutes, those
Yeah.
kind of things. Because that can be a quick fix, just kind of seeing that might be the underlying reason. But even still, I will say, there's people that I work with that don't have the irritated bladder and issues, and they have coffee and maybe they do go a little more frequently, but it doesn't spiral them into like leakage or
Mm.
things like that. It's like it's still manageable. So
Yeah.
even if you're having coffee and like it's a big issue, I still think it's kind of like Jenga, where it's like if you take a piece out and then you take another piece out, you take another piece out, and it's like, oh, it's getting wobbly. You take one more piece out and then it falls over. It's like
Mm.
somebody who doesn't have a lot of issues can drink coffee and not have bladder issues.
Yeah.
But then somebody who's got the restrictions in the fascia and your bladder's pulled off to the right. And these things we don't know what's going on. And then you have coffee and it's like everything just falls down. So
Yeah.
yeah.
Yeah. Very, very individual.
Very individual. Exactly. And I think that's the other story for us as women that, having babies, it's like we look at the Instagram feeds, we look at our friends, and I know I can say this from personal experience. I look at you, Adrienne, and I'm just like, oh my gosh, you're doing so much and exercising and just make pregnancy and postpartum look easy. And I know like we all have our own battles and struggles and all that, but I think that's why we all have different stories and need to really respect our own body
Yeah.
and seek help for, things aren't feeling normal. If we are going every hour, every 15 minutes, or, anything like that, or having to, one of my patients is like, I used to have to pee in a bottle if I got in, uh, stuck in traffic. Like, I couldn't hold it more than an hour and I'd have to drive across town, as maybe a real
Okay.
estate agent or something. And she just was like, that's her normal. She didn't think anything about it. And so it's great to be
Wow.
able to help women, not have to
Yes.
to do that. But I think that's something that, if you're comparing yourself to others, it's like, one, maybe they have different struggles than you, but two, maybe getting a little more help. And there's a reason why that, your postpartum journey is a little more of a struggle than others because there might be something going on underneath the surface that can make it a lot easier.
Yes. Yeah. I mean, I'm thankful that I think my body has treated me very well, but I also have the knowledge that I've learned from you. Even quick little things like, not quick little things, but simple things like knowing what a bladder irritant is.
Mm,
And what, because like coffee for me, like I have a cup every morning, but I try not to take it, to drink it before a run. It makes
right.
it, I used to be able to do it no problem before pregnancy, but now that I'm like heavier, I feel the difference. So I'm like, okay, I'll just hold it off till later. Simple fixes like that because I know that that's a bladder irritant. And then simple, simple little techniques like quick pelvic floor contractions to like reset the whatever that it just helps me hold in urine longer. And it
Oh
was just a
yeah.
technique that you told me. It just like quick little contractions. And I guess, I don't know, I think I just do like 6 or 7 of them. And like that urgency, that feeling of wanting to go goes away.
Yeah.
Um, but it's just having those little tools in your toolbox, learning from someone like you, just like allowed me to do the things that I want to do, and not have that other like those little nuances of pregnancy that can be kind of annoying. But there's simple ways to work around it, because you know the science behind it. So thank you for that.
Oh, well, thank you for sharing and thank you for
Yeah,
applying, that. And I'm
yeah,
so glad it works for you, it worked for you. And yeah, the quick pelvic floor contractions that can really help calm the bladder, right? It can kind of like that's what the urgency is it's the bladder squeezing and saying, hey, I need to go to the bathroom right now, or at least that's what it's trying, it's trying to tell you something, and sometimes that's the case. But you can help calm it with those quick pelvic floor contractions. But I will also add that that doesn't work for everybody. So that's where
yeah,
also the art, I guess, is like finding what works for some people and
yeah,
what other people need, where some people already have pelvic floor tension, and so if they try contracting more, there's
doesn't
nowhere
do
for those muscles
anything.
to go. And so for others, and saying this out loud, like, and others might not know, like, if they're contracting properly. And so we
Yeah,
found out that you were, and found out that that could help you. But
yeah,
others that are working on tension, maybe just deep breathing and trying to open and soften the pelvic floor muscles can then in turn relax the bladder. And so that I
yeah,
think also is a common thing that my patients need, is more of that like relaxation piece
yeah,
before then we can work on like that strengthening.
yeah. Well, again, highly individualized. So, which kind of leads into the next topic. Every woman has a prior history of exercise experience. And then there are some, I mean, it's pretty well known now, I think, that whatever activities that you were doing prior to pregnancy, as long as like you're in a low risk category of pregnancy, you can resume those things. But um, for just two things, how do you define a low risk pregnancy? Like, how do you know if you are one? And then two, if you're not, what conditions are warranting stopping exercise or modifying it? So we'll go with the first one. What defines a low risk pregnancy?
Yeah. I mean, I think in America, for the most part, it's easier for me, because it's like the doctors are monitoring that and they're saying, yeah, you're okay to exercise. Then it's like, okay, maybe we'll be checking vitals if we know they have higher blood pressure, things like that. So
Mhm.
that's definitely something that would warrant for a higher risk pregnancy. Obesity is another one, if they have any pre-existing comorbidities like diabetes or, like I said, high blood pressure, all of those somebody might be going into pregnancy with. But then on the flip side, sometimes things they develop during pregnancy, like gestational diabetes or, gestational high blood pressure, things like that, where they didn't have it before, but they do now. Those are things that your doctor will say, like, hey, the exercise is not good for you right now. It could be that you have multiple babies. That can also increase your risk for exercise not being great for your body, at this time. And then I will also add the placenta previa. And so that I say that because I've had a couple patients that their doctors were really monitoring where the placenta was growing in the uterus. And if it's really close to the cervix, so the opening of the cervix, the vaginal opening where baby's going to come out, if it's really close, they really will, kind of put you on bed rest and make sure that you're not doing anything that will cause your body to overwork or things, for that to start coming down, like anything that might happen.
Does that
Um,
cause like a prolapse? Why does it matter where the placenta is in the body, in the
yeah.
uterus?
So it's gonna then make it so baby won't be able to come down and come out of the cervix. And so it will really basically like hinder the birth process. And so they just want to make sure that it's, yeah, higher up, which most of the time it is.
Yeah.
But that's something that they do, during your ultrasounds. They're checking where is the placenta of the health of the placenta. And so I've had some patients, say like, oh yeah, my doctor's monitoring that to make sure it's not
What
placenta.
causes it to be in a lower position?
So it's basically like where the egg attaches, when
Oh,
we're like, we don't even know we're pregnant at this point. And the egg, is fertilized and it attaches to the uterine wall. That is where the placenta grows from.
oh my
And
gosh. So it's
so,
just by chance?
yep,
Oh,
exactly. Yeah.
and then how common is um, placenta previa?
I know it's pretty low. I
Or
had
was it
one recent one that was put on bed rest as a concern, and actually I've had two.
yeah,
So out of
out of
hundreds,
yeah. Yeah,
hundreds,
okay.
it's only been two so far that they didn't have any issues with that. So it was okay, but they were put on bed rest
Yeah.
for a while their doctor was monitoring that.
And bed rest, if someone told me to go on bed rest, I would need to know what that entails
Yeah.
because when you think of bed rest, it's just like, am I lying down the whole time? Can I get up and walk? Can I go for a walk? What is like the parameters of movement when somebody says that you're on bed rest? It's
Yeah.
like,
It's, yeah, nothing strenuous, nothing, you're not really lifting anything. You're supposed to be laying down. Like sometimes they actually like need you to lay down a lot more. But you can get up and move, I mean, we should be able
Like
to
your day-to-day type of things is
day-to-day
totally
type of
fine. Yeah.
things should be okay. But I think that's, and again, the OB is the one to really like, set the guidelines, because it's also going to be different person to person and what your medical like comorbidities might be, all of those factors. But yeah, it might be like pretty limited. And usually, like if somebody has twins and they're tired, they're fatigued, and their body is, they're just trying to make sure baby stays inside,
Yeah.
or that's where, yeah, maybe they've had like some amniotic fluid leakage and the doctor, caught that, and they're still really early and they don't want you to have baby yet, and so they really want you to just lay low, and that's the case where it's like we want to keep baby inside and not do anything to kind of spark the birth process,
Yeah. Okay.
Yeah.
Interesting. And then to clarify, is high blood pressure in pregnancy, the term is preeclampsia? Is that the same definition?
Yeah, it can be. So there's factors that really make it a diagnosis of preeclampsia, and it's essentially high blood pressure is one of the biggest ones. And it's if your blood pressure's at or greater than 140 over 90, 20 weeks gestation, and you didn't have high blood pressure before that 20 weeks of pregnancy.
Oh, okay.
Yeah, so that's probably the biggest factor that somebody will check, but the doctors will be doing labs as well, to see, is it just high blood pressure or is it
Side going.
something more of a systematic issue. They also, another classification would be like liver enzymes. So like the liver's working harder, and yeah, there's people can have vision issues, kidney issues, like it's affecting all of your body. So that's why preeclampsia really is a serious condition, and it's pre for eclampsia, which is where you're having seizures. And so it's more of like, yeah, a system
Like,
failure,
yeah.
And there is something in between, which is severe yeah. So there's preeclampsia, which is that 140 over 90, and then severe preeclampsia, which is 160 over 90. And then, but yeah, that's like even higher. And then you've got like more of the liver enzymes that are not good for us to have in our blood, that are in our blood at that time. And then that can like lead to then eclampsia, which is the having the seizures and can have more organ failures.
Okay, so because I wanted to talk about exercise and what conditions warrant us to
Yeah.
stop or modify. So is preeclampsia a condition where you recommend no physical activity or modified?
Yeah, I mean, if they have, and I have only had patients, and I've had a few of them that have had the diagnosis of preeclampsia, but they were hospitalized for it and had their baby, right away. And some of them had their baby, they went into labor and then were getting high blood pressure. And others like went into labor maybe a month early and had preeclampsia, and high blood pressure issues around that time. And so it was definitely like my recommendations to one of the clients who wasn't, she was a month early before, her guest date, due date, and she was having high blood pressure. And, it was like, call your doctor. They need to know this and see what's going on. And then they had her like monitoring it regularly. And so anytime we had our appointment, which we only had like one or two before, then she was admitted and needed an emergency C-section essentially. Yeah, we were just monitoring her blood pressure. And if it's high, I'm not going to put them, through exercise. But at the same time, the work that I'm doing for pregnant mamas, we're working on the pelvic floor muscles and actually working on like breath work and relaxation and all those wonderful things of trying to move them towards that smoother birth. And so I would say if it wasn't too high and the doctors were okay, our sessions would actually possibly be helpful, and the homework that I would be giving them would be helpful. But if we were doing like runs, or, maybe they were earlier on, I would probably just, communicate with the doctor and monitor their blood pressure before and after each session, and then really keep it like symptom, like related, see how they're doing, check in often, look for, are they overheating, like all these things. But if they've got a diagnosis of preeclampsia, I probably wouldn't push it through. That would be like
Yeah.
you need
Yeah.
to rest or get to
Yeah.
the
That's like
hospital.
would you say it's more of a yellow or a red flag in your book?
In my book, it would be red.
Yeah.
Yeah. If they've
Yeah.
got high blood pressure, if it was one reading, then, I would take it again and we would
Hmm.
chat and we would rest. And if it was still high, it would be a call to the doctor, or let's drive you there just to get it. You drive there, like if they
Yeah.
need help, I'd drive them.
Yeah.
But yeah, and just get it checked out, because that is something that if it's happening for longer, especially if they aren't, in tune or aware of that, it can impact blood flow to the placenta, blood flow then to the baby. And that's when it's like, oh, we need to get this baby out now. Yeah,
Yeah.
it can be pretty serious.
Yeah. With those mamas, I can see the even more importance in using the breath work and calming down their nervous system to hopefully give them the tools to learn how to lower their own blood pressure in that way.
Yeah.
Yeah. I wouldn't want to
Yeah.
be exercising. But it's good to know because it's listed in things that are contraindicated or a precaution. So it's good to know what is a red flag, like contraindicated for exercise. I did know that it was not a condition where you should be pushing it, but it's good to confirm it with you. Now, enough of the scary stuff. Because most pregnancies, it sounds like, are healthy and normal, and maybe they just have back pain. Of the low risk pregnancies, are there any things that they should be avoiding during pregnancy? Any movements that we should be avoiding? Because I know that there is some controversial things that people are talking about, like sit-ups. Should we never do sit-ups during pregnancy? Or should we never lift heavy during pregnancy? Like where are you at?
Yeah, no, it's great. And yeah, this is something that is definitely, there's different camps out there. So join which camp you want. But the one that I, believe and in my heart believe is there isn't anything necessarily, like in general, that we definitely shouldn't be doing, because everyone is different. And like we said before, there's like everyone's going to be coming into pregnancy and birth with their own history, their own story, their own experiences. And somebody who's like a gymnast, or something, Carissa Moore being an amazing athlete surfer, like, yeah, no wonder she's, was surfing well into her pregnancy. And so I think people that have a good history, they have, all the makeups. Like for you running, like you ran, later into your pregnancy than maybe most mamas would. And so that is going to be much different than somebody who's like not used to that. And, pregnancy maybe isn't a time to start something new. It's
Yeah.
maybe something that I do believe in general. But I think the thing that I really try to help my clients with is to see what works for their body and what's too difficult for their body. And so, like for crunches, somebody who has good core activation, good body awareness, and they do a crunch and can, kind of hold that in. And let's say they're not really pregnant, but they're just like maybe, second trimester or something like that. And their abdominal wall looks good and it doesn't look like it's being stressed, they maybe can still do some of those activities. But I also try to help them understand that as their belly gets bigger, it's again back to that like Jenga piece, that you're going to be taking out a few more pieces as your belly gets so much bigger. It's just stress on these tissues. The abdominal wall, the muscles, the fascia, those are meant to stretch. The tissues themselves respond to stretch. That's their communication. If they get that feedback of like baby pushing outward, they're like, oh, you want me to be here? Okay, I can do that. Baby grows another, in this week. Oh, you want me here now? Okay, I can do that. And they'll cell by cell by cell lengthen over that, 9 months ish. And so then it's just a lot of stress on these muscles. Then if you try to do a sit up and you aren't controlling that well, or it's just too much, then you get that doming, you get that coning look to your abdomen. And again, a little bit of that is okay, but that's just a sign that pressure's coming outward on these tissues, that pressure's already coming outward on with baby growing. And so it's like that over time can just add more stress that then you have to like heal after, heal
Yeah,
more.
yeah.
And so I do really teach, the log roll, like rolling onto your side, using your breath as you, sit up from your bed, like sideways, and using the breath as you exhale, doing the hardest part of the movement. And even rolling in bed is really challenging, or even lifting your head up. We think, oh, I'm not going to do crunches in my exercise class, but then when you sit up in bed, you come straight up. Essentially, you're doing a crunch,
Yeah,
and so
yeah. Just knowing what to look for. Like
yeah,
a lot of people don't know what coning or doming looks like because like you have a shirt on, you're not really looking at what your abdomen is looking like when you're doing something functional like sitting up.
yeah,
So yeah, just having that educational piece is kind of a
yeah.
fun little experiment. Like as my belly grows a little bit more, it's like, hey, still doing this.
Can I still do? Yeah, yeah, and finding
Yeah,
that point when
yeah,
it's too much for your body, because
yeah,
that might be 8 months for some women, and it might be 2 months because they never really had, that
yeah,
foundation of how to activate their core, and
yeah.
so,
But two
um,
months is a great time to start though, because like that
mhm,
like tension of the muscles isn't like expanded yet. You can
yeah,
still learn how to contract those muscles.
yes, yeah,
Again, really, really good to see a pelvic floor therapist because just bringing that awareness to your abdomen, to your pelvic floor. It's
yeah.
like, yeah, some people don't know how to activate their core and their breath, what that looks like. Yeah.
Yeah. I did want to add, sometimes it's hard to see your belly and you don't know, like you said, you have a shirt on, but even itchiness can be kind of those nerves and the skin is stretching and it's like, oh, after a workout, I feel just itchy. And that might be a little sign that your belly's it's working hard. Those tissues are
Yeah.
working hard and
You
maybe
should
need
tell
you to
Kelly.
back down a little bit. Yeah. Yeah. But yeah, you mentioned, core activation. And I think that is one of the things that I really try to work on with clients. And a lot of them are, I get a mix of like those that are wanting to come to see me because of pains, pelvic or back pain or things like that. But then also those that are wanting to prevent it. But all of them, I'm doing, a screen for of how is their core activation and how is their pelvic floor activation. If they're feeling good, a lot of times it's because these foundational pieces are in place. And
Yeah.
so I just try to bring awareness to that of like, hey, look at your belly, like look how look how it's not doming, like see how you can activate this. Whatever you're thinking about, keep doing it, because it's
Yeah, yeah,
working.
yeah.
That kind of a
Yeah.
thing. And then
Everyone
with
needs a
pelvic
different
floor.
cue. Like
Yes.
there's like you have the flower cue, like relax your pelvic floor, like that flower
Mm-hmm.
opening, and then contract like you're sucking a blueberry up your vagina. Like there's so
Yeah.
many interesting cues that I've learned from you guys.
Yeah.
They always make me laugh a little bit. But yeah,
Yes. And I'm
um,
always learning more and figuring out more because different women have issues in different areas. So it's not
yeah,
just like you can fire it or you don't. It's like sometimes the right side might be working better than the left, or the more superficial pelvic floor muscles might be working, but not the deep pelvic floor muscles. And then that can increase your risk for, bladder issues, prolapse, things like that. And so I'm learning really that art I was talking about is in that customization is okay, they're contracting the more, front part of their muscles. How do we get that deep part activated? And then it's going to be different person to person. And as to why it's not working and how we can get it working again. And sometimes it's the tissues just need some TLC and need that mind body connection. And once you can connect to them, then hey, they're firing. You feel that. Okay, now let's practice that with some breath work and movement. And others, it's actually like, and not to get into the weeds here, but it's trauma, physical, but
Yeah.
also sometimes emotional. If you had a rough birth experience and there's fear connected to that, your body, the pelvic floor muscles are protection and they're still in that protection mode. And so again, if your friend's having a much easier time and you're not, like, maybe there's something on that level that just needs some attention, some light shine, sunshine on that area. And then all of a sudden, bam, those muscles, quote unquote, magically are working better. And it's not because I'm magic, it's just because your body was holding something, keeping these muscles from being able to work their best. And now that you can connect to them, all of a sudden you can work on that strength. Your body has a different layer of stability. And then bam, 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 it might take a little bit more work, or it could be just continuing whatever movement you enjoy already. Now your back pain's getting better. Now your leakage is better. Like, everyone's story is different, but that is something I very often, am working with patients on.
It's a big piece of understanding what your body needs, like you were saying.
Mm-hmm.
Everyone's so different in terms of like what their body needs during this time and like how much awareness they have in their pelvic floor, their abdomen area. Um, it's great. So like kind of to like round things out a little bit, we're understanding the importance of like having that awareness around the abdomen, the pelvic floor, how to coordinate breath,
Mm-hmm.
but around just like overall exercise
Mm-hmm.
during that prenatal time at least, because I know a good amount of mamas that just didn't feel good during their pregnancy. They were uncomfortable, but they were still low risk. And the days that you do feel good, I would say moving your body, like even during the first trimester for me, of course I was tired and things like that, but there was something within my body routine that kind of craved some kind of movement. And of course it looked completely
Yes.
different. But just to remind mamas out there that exercise is medicine. And if you are low risk, respect the time that your body needs to rest. But the benefits of exercising are immense for you and baby. I learned a lot about it, and I kind of just want to like share, and you can chime in too, just like the
Yeah.
benefits of prenatal exercise, not even prenatal exercise necessarily, because like the American College of Sports Medicine recommends for every like adult, at least in the United States, like 150 minutes a week of moderate intensity exercise. And that can include brisk walk or a little bit of gym time, something that gets your heart rate up, gets you sweating a little bit. You don't have to be out of breath, but just to get that heart pumping, the blood flow to the placenta, and all the
Mm-hmm.
things like the 150 minutes a week is just recommended for healthy adults in general. So just I learned that even just hitting that during your prenatal time, studies have shown decreased need for medical interventions, decreased glucose levels, and your chance for getting gestational diabetes or preterm labor. And yeah, just remember that exercise is medicine, and you're doing your body like and your baby a great service by just getting your body moving in the ways that you can and that you enjoy for the most part. Like I think that's the biggest piece is like enjoying the movement that you're doing.
Yeah. Absolutely. I had a recent patient who, in her first trimester, she, didn't feel great, but was like, I felt better after I exercised. It was so hard to get myself going, but once I did, I knew I was going to get relief from, the nausea and maybe take
Yeah.
a better nap, or something.
Mm-hmm.
But yes, you're absolutely right. And I thank you for that, beautiful reminder of how important it is for lifelong, and it's going to really set us up for success postpartum too, because our baby's going to keep growing, and it's like,
Yeah.
and just with any surgery, there's PTs, like if you have a knee replacement, a lot of times, hopefully, your surgeon will send you for PT before to really build up your muscle bulk. And then after your surgery, recovery is so much better. There's plenty of research that supports that. It's like we essentially can do that for ourselves by staying active, during pregnancy. And then postpartum can be a lot easier. Menopause can be a lot easier. As we age, it gets harder to build muscle, although we can. But we should be lifting. We should be lifting heavy weights. And if it's not comfortable, if you're feeling bulging in the pelvic floor, if you're feeling your bladder, having bladder leakage after, there's something foundational that's off. And if you can get help and support around that, exercise then can be more comfortable, can feel good, and actually support your healing tissues, and
Yeah.
then you're feeling stronger and better. It's like I see it all the time when we can get that peace. The woman feels so much more comfortable, so much more confident, and exercise actually feels good instead of it being a hindrance or, feeling like, oh my gosh, I'm going to leak after this, So yeah, that's
That's
why
such a
I
big
love
piece
what we
though.
do.
The prehab before surgery
Yeah.
improves your outcomes for post-surgery. And one, it's not recommended enough. And two, it translates into, I know giving birth isn't surgery, but it's a form of trauma to your body. So it's
Yeah.
just like, even though you don't have anything like leakage or pain or things like that, just having some kind of like knowledge base around where your body is at with the pelvic floor, even just like an initial assessment before you give birth is such a powerful tool, that prehab before birth.
Yes.
Yeah, because things are
Yes.
so different after you give birth. Things have already kind of like gone through that trauma. I wish there's a better way for that. Because
I know.
it's not like it is, it's just the,
The
you get what I mean.
connotations, like,
Yeah,
yes,
it's such a negative connotation because birth can be like very beautiful. And so
the
that
change.
experience just changes you.
Yes.
And sometimes that change makes it harder to reconnect to like, okay, what should it feel like now? It's just already kind of like, it's already altered. So yeah, highly recommend wherever you are in the world, go find your pelvic floor therapist. If you're in
Yes.
Honolulu, come see
Yes.
Jenna. Yeah.
You're here in Hawaii. I'd love to help you. Yeah, but there's, a growing amount of pelvic PTs and the need is there. And I'm not big on social media, but I also am grateful for it because I've been doing this work for 10 plus years, and we were just trying to get doctors to send us patients in the beginning, and it was like, some would, but it was the ones that really had been having issues for 30, 40, 50 years. And now women are hearing on their own. It's like this grassroots effort of like, hey, I deserve this. I want this for my body. And, so I'm seeing a lot more women coming in for preventative care during pregnancy. And I'm able to then, help them understand what's going on with their body so that they can keep exercising and keep doing, yeah, what they love to do, and then setting themselves up for postpartum success as well, not only because they're able to stay active, but also because then they understand their body and how to get their core activating properly after the big changes. And then I will add too, I see more women, in their 20s and early 30s, like, I think one day I want to have babies and I want to set myself up for success. So it's like that
Yeah.
looking, I am like, you are so forward thinking. I wish I was that forward thinking, but
Yeah. I mean, yeah, and it's a testament to what social media and
yeah.
the things that they're consuming online, because it's being talked about more. So thanks for
Hmm.
adding to it, because hopefully this helps a lot of mamas and future mamas like decrease fear around exercise and just have a healthier pregnancy and be prepared for birth. And there's so many tools out there, and sometimes it's just a little bit of an investment can go a really long way. for your health, and not only just postpartum, like the first year down the line as we age as a woman.
Yep,
Yeah,
absolutely. Setting
solid
the
foundation.
stage. Yeah, we're setting that foundation for success, yeah, through the rest of our life. Absolutely.
Thank you so much for what you do, Jenna.
Thank you. And thank you for what you do and also being so inspiring to keep moving. And movement is medicine. So thank you, Adrienne.
Thank you for being on the podcast again. I appreciate your time.
Same. Oh, I would love to do it again anytime.
Hey, mamas and my active people. So, I really hope you found this episode insightful and helpful for your pregnancy and postpartum journey in ways that you can keep healthy and active. It's so important to stay active, and I hope you found some guidance with this episode and that there is help out there women can get that is unique to your ever changing female body throughout your lifespan. So, thank you again for sticking around and learning with us. And if you enjoyed this episode, be sure to subscribe and share. It means the world to me. Thank you.